I'm Riley Reese. This is the Sophia Unfiltered podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. I'm grateful to share these powerful stories with you, and I especially love listening to the conversations that are led by my friend and co-host, Dr. Michelle Cole. Michelle is a licensed clinical psychologist, somatic experiencing practitioner, and yoga teacher. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go.
Welcome back to another episode of Sophia Unfiltered. I am your host, Michelle Cole, on a solo episode today with our guest, Dr. Sara Herman. After completing her undergraduate studies in human biology with a specialization in technology and society at Stanford University, Dr. Sara Herman pursued advanced training in cardiothoracic anesthesia through programs at both Harvard Medical School and Columbia University. However, it was a profound personal journey during her breast cancer therapy in 2017 that catalyzed her transformation from a career in the operating room to a passionate advocate for psychedelic healing. Dr. Sara has since undertaken rigorous and comprehensive training in the realm of responsible and ethical psychedelic-assisted therapy and integrative healing. Her education includes programs at renowned institutions such as the California Institute of Integral Studies, the Ketamine Training Center, the Integrative Psychiatry Institute, MAPS, the Multidisciplinary Association for Psychedelic Sciences, and the Academy of Integrative Health and Medicine. She focuses on the practice of psychedelic medicine with unwavering ethics, integrity, and a holistic approach to patient wellness. Dr. Sara, welcome to Sophia Unfiltered.
Thanks, Michelle. It's so amazing to be here.
I am just taken by your story. So you're a classically trained anesthesiologist working in the operating room, and then your career just took a deviation there, and you found yourself doing ketamine therapy full time. So I'm really curious about that journey and about your background.
Yeah, so I have been in the operating, or I had, I guess, have been in the operating room in private practice for over 10 years. And then the pandemic happened. And so people that are still working in person are usually anesthesiologists over the COVID pandemic and people in the operating room and such. And so we were very busy. I was burnt, truthfully. And I started getting into breath work. And I did a few breathwork classes virtually because initially they were going to be in an in-person studio in San Francisco. And I had never done breathwork and thought to myself, I'm not going to some woo-woo breathwork studio. And so when it was virtual, I thought, okay, I'll give it a try. And sure enough, it was very transformative. And as part of those breathwork experiences, I kept getting the message, ketamine clinic, which was surprising to me, although at the same time, not overly surprising. I had been giving ketamine to folks as operative patients for years. In fact, my little moniker in the hospital was the ketamine queen because no one else was giving it to people. I just felt like they deserved it, and it's an excellent medicine and a safe medicine. So I just really felt that patients could benefit from a pain perspective, really, at that point. I didn't know so much about the other transformative effects in terms of depression and anxiety, trauma, et cetera. I knew lots of people who had used ketamine recreationally. I had not ever tried ketamine personally, although I have been a field explorer in psychedelics since the early 90s. And so as part of that download from the breathwork, I thought, well, maybe I should get my own ketamine infusion and see what that would look like. So I went to a practice in the area where an anesthesiologist was giving the ketamine, and it did not go well. And so I thought to myself, interesting. I'm not so sure about this, but I know I could do it better. And so that's kind of where this whole journey began.
Oh, wow. The ketamine queen.
Yeah.
I love that. And you were using that in the operating room for pain mainly. So it was helping your clients feel less pain, or why were you the ketamine queen?
So ketamine is good for a lot of things in the operating room, not just as a sole anesthetic, but if you give ketamine as an adjunct to a multimodal, what we call analgesic regimen, which allows for medicines other than opioid pain medicines, which come with a lot of side effects, including respiratory depression, constipation, nausea, vomiting, these kind of things. Ketamine allows for less use of opioids. And also because of its mechanism of action, it almost blocks the pain transmission. So if you give a certain amount before incision, it even though your brain is sleeping from the anesthesia, your spinal cord reflexes are still awake. And so giving a certain amount of ketamine before the incision of a procedure also helps to decrease the pain afterwards.
Wow. So it's a really powerful assist for pain. And how is it discovered that it's helpful for depression? You mentioned depression, PTSD, anxiety, anything else that you might use it for?
I mean, truthfully, it has a lot of benefits. Those, the treatment resistant depression is probably the most studied at this point as far as its off label uses. I'm not sure if you're aware, but ketamine is FDA approved only as an anesthesia medicine. And so anything that is used in the mental health realm or even in the chronic pain technically is off label. And so the one that is most studied is the treatment resistant depression at this point. And it goes back, basically there's a physician, Dr. John Crystal out of Yale, that in 2000 was doing studies to look at ketamine in mental health. I think his goal was to recreate more of a pathophysiologic model that was similar to schizophrenia because of the known dissociative effects that people were considering negative. But when he was studying, it turns out that it became more of an antidepressant rather than a medicine that produced psychosis. And so from there, then there were trials that looked at, or maybe not trials, but studies that looked at weight-based dosing, 40-minute infusions 3 times a week for 2 weeks. And they noticed that depression was improved, if not in remission, in, I believe the number is 70% of patients. And so that was very early on, very clinical setting that they were in. Didn't account for any psychotherapy, no integration, no preparation, more just using ketamine as a drug to treat depression.
And when you mentioned treatment-resistant depression, what kind of makes something treatment-resistant depression? Are there kind of qualifiers that are kind of
Well,
hallmark
for
of that?
folks, there's a lot of people out there where they've tried multiple different antidepressants in different classes, different medicines within the same classes. And so when you have tried and failed for a specific length of time, more than 2, I believe, you're classified as treatment resistant depressed. So it's a matter of sticking to a medication trial for a certain amount of time before considering it ineffective, or if you develop side effects, something like this. And so you have to have tried and failed multiple medications to be considered treatment resistant.
Okay. Yeah, I know psychiatry is such an inexact science. There's with the SSRIs, we've got some guides on what might be the best one to start with, but then it's kind of trial and error. And there's a lot of side effects that go. And oftentimes folks drop out because they can't make it through the side effects. So they don't get to feel the therapeutic benefits. And so would ketamine be indicated as a first line treatment for depression? Do you have to go through SSRIs or could you just start with ketamine?
I think it depends on who you ask, truthfully. Again, because this is an off-label treatment for this indication, it's really a conversation between the client or the patient and the provider, in my opinion, because ketamine, it has a very good safety profile. The risk benefit ratio may be something worth discussing because the side effects are minimal, truthfully, and the risk of ketamine causing harm is quite low. In my opinion, when folks come to me, I don't require them to be classified as treatment resistant in order to engage with ketamine therapy.
That's really interesting too, because it sounds like there's a course of ketamine therapy, and the thought is that the depression will go into remission, which is pretty different than the SSRIs, which require you, I mean, you need a couple months for them to even show the therapeutic effect, and then you need to stay on them. And I know a lot of the clients that I work with don't like the idea of having to take a medication every day for the rest of their lives, although sometimes it's indicated. But this is exciting that you could come get treatment, depression could lift, and you just kind of move on with your life.
I mean, the way you're saying it makes it sound like it's pretty easy. I would I would say more that ketamine is more of a tool. So yes, there are biochemical properties that help to quote unquote lift the depression, but in most cases, and this is the way I practice and many people practice, is using ketamine as a tool in conjunction with psychotherapy and integration, both during the sessions and in between the sessions. So when people have that idea of like, oh, here's this magical medicine that is going to fix me, and I'm coming to this doctor who's going to give me this magical medicine and they're going to fix me, and then I'm not going to need it again. That's where I think people get tripped up, because they're expecting this drug is going to be the fixer, but really it's a tool. It's a catalyst that allows people to get out of that negative self-talk loop, or in that concrete way of thinking, and make more flexibility available to folks to allow them to work with a psychotherapist and or an integration specialist to help change their thought patterns. And so it's less the ketamine is going to fix the depression. Yes, in my opinion, some rare cases, the ketamine is all you need. But in most cases, there is work that goes into the change in perception and the change in lifestyle. This is a lifestyle change, period. And it takes work on the end of the participant. And once you're on these journeys doing this deep dive into self, it's really being vulnerable with yourself and understanding at the core, who are you, what's important to you, how can you live authentically, and learning and taking those, downloads and messages with you into the world, and actually making changes, whether it's diet, exercise, sleep, including, community practices, cultivating joy, doing whatever it is you like to do. You need to figure out what is supportive for you. And that's really how the changes are made. The ketamine and any of these other psychedelic medicines, it's less about the medicine, in my opinion, and more about what you do in the context of the medicine.
Yeah, so if you're looking for ketamine to be the magic bullet, this is not going to happen, that you need to do the heavy lifting. Ketamine is just something that's kind of like that assist that provides a window of opportunity for you to do the work. Yeah, and I've read that ketamine increases neuroplasticity, and we know that like really past the age of 20 or so, it's really hard for the brain to be more neuroplastic, and this is opening a window. So could you talk a little bit about how that works, and why ketamine is so helpful when you're ready to roll up your sleeves and do the work?
Yeah, so truthfully, this is, in my opinion, what everyone is trying to get is that neuroplastic effect. And so it's based on the mechanism of action of ketamine. So when it does its biochemical thing, you get a bunch of downstream protein changes that lead to the correct environmental biochemistry that allows for neurons that wouldn't usually talk to one another to talk, and also to heal tired and damaged neurons. So you're getting healing based on these downstream changes, and also new connections are made. People talk about this neuroplastic window, which is anywhere from 24 hours to 72 hours is when it's most active. I feel like I've noticed in clients a longer window at times of 1 to 2 weeks, where you just really are able to harness the energy and the clarity and or feeling motivated to make changes.
During that window, what would you recommend that your patients be doing, or maybe that they not be doing?
To start with the not doing, again, what this whole journey is about is really focusing inward. And so if you can imagine trying to eliminate the noise, now we're talking social media, the news, stressful conversations, stressful people, activities that maybe aren't as supportive for you, to take away, and then incorporate activities that would be supportive for internal work, so to speak. And it doesn't have to be the same for everyone. Some people find journaling helpful. Some people use voice memos. Some people choose walks in nature. They do meditation, breathing. They do yoga, qigong, acupuncture, you name it. If it's supportive of a lifestyle that you're looking for, that's something to include. But really, Googling why this or that, what that means, asking other people's opinions isn't learning to trust yourself, trust your intuition, your gut feeling, your knowing. Your inner healing intelligence is something that the psychedelic community likes to talk about. And really turning inward is what's most important during that neuroplastic window. And, if you're looking for support, it's important to have identified maybe some integration folks, whether it's supportive family, supportive friends, a psychotherapist, an integration coach, something along those lines, that aren't going to be judging you for your healing path, and also are going to understand perhaps in some way how to support you rather than quizzing you or questioning you on what's coming up.
Yeah. So if I'm hearing you, it sounds like it's super important to be mindful of what you're feeding yourself in terms of everything, through all of your senses. And then also, if you had nothing else to go back to, is just be in silence, trust yourself, stay with your body sensation. And I truly believe that we move toward healing, in the absence of a push one way or the other. Our system wants to move toward healing. And so it really, I think, empowers the client to move into their own healing and start to trust that and hear that healing voice inside of them.
That's exactly it. It's not relying on a therapist or a drug or a X, Y, or Z. It's trusting self to really guide the way and have all the tools to cultivate that healing.
Yeah. And what have you seen work the best with ketamine? Like, what are some of your best success stories where you're like, wow, that person's life is profoundly changed?
In terms of maybe not client specific, but generally, folks that are coming with the motivation of change, regardless, truthfully, of any sort of diagnosis, are the ones that really do well. I also find that people that are really stressed and or burnt out from either work or family or some other, stressful encounter, whether, I don't know, it's not necessarily a trauma per se, but this high stress environment, ketamine is really helpful just in terms of shifting perspective and giving them thoughts on how to either just be grateful for what is there and or see different sides of the story that they're telling themselves, and or just have more patience related to family, work, you name it. And so it varies. People that are coming, I've found that really are those treatment resistant, depression, super, just hopeless, go one of two ways. It's either, there is this huge shift and the depression is lifted, and then they're able to engage in these activities. Actually, there is one person that I'm thinking of specifically where they had come to me with a psychiatrist and a therapist, and the person was chronically suicidal. And the psychiatrist basically told me he is not to be admitted. He is, ketamine is almost like a palliative attempt at keeping him alive. And that was over a year ago. And he just got a job. He just emailed me actually this week that he has a job and he isn't as functional as he was 20 years ago, but his life is much more fulfilling. He is not suicidal and has not been for the last few months. He's able to do psychotherapy in a more relaxed way and something that is helpful to him. And so that he's really one of probably the most extreme examples of ketamine helping with suicidal ideation and really changing a life.
Yeah, it's got to feel so good to just see the impact that your intervention has had on, like you said, saving a life.
Yeah. Yeah. A lot of people with trauma too. I mean, the people that are struggling, and there's a lot of folks out there struggling with sexual trauma, which truthfully, as an anesthesiologist, when I first started working in this realm, I wasn't prepared for just the depth and breadth of people coming with similar traumas. And it really has been helpful for folks with trauma to work through as well.
Yeah. And you mentioned part of the heavy lifting that a client does, or if they're going to get the full experience, there's preparation and there's integration afterwards. And I'm just curious, what does that consist of?
So in my practice specifically, the person will have 2 meetings with both me and my assistant, who's a certified psychedelic preparation and integration coach. And so we talk about, first of all, what to expect with ketamine logistically, risk benefits, alternatives, the side effects, the nuts and the bolts of just what ketamine will be. And then we also go through in detail, where's our mind? What are we expecting? Expectations, especially with the internet as widely available as it is. And now that ketamine's becoming more of a common and or popular treatment, people are expecting any number of things. And so it's really helpful both to just name expectations and understand really what ketamine can do and cannot do. And so I have a colleague who says ketamine is not an oracle and it's not a miracle. And so it's important for people to realize that there aren't going to be these banners that show up with, this is what you need to do to change your life. This is what, quit your job, move to a different state type of thing. This is more learning how to be okay actually with not getting answers and learning how to sit in discomfort. So we go through in detail what discomfort, overwhelm, or intense situations during the ketamine itself might feel like, and how that is applicable to working with situations in regular life, so to speak. And so the preparation also revolves around, what does safety feel like to folks? Because a lot of this process is feeling safe, both with yourself and safe enough with the provider you're with, and feeling comfortable and trusting the medicine, the situation, the process, to really allow yourself to explore. And so we go through what safety looks like, what quote unquote therapeutic touch might look like, that something would be either yes or a no for each person so that they feel comfortable during sessions. We also talk about agency and how this isn't, again, I know what's best for you. It's a conversation. And so the person really, we get them thinking about, what does that look like for them? Safety, agency, trust. And so a preparation session is a lot of talking about those things.
And then integration, what does that mean to do an integration? How would that be different than just a normal session with your therapist?
So integration means make whole. And so what we like to think of integration is more about connection making and then figuring out together what is supportive to make whole. And again, like I mentioned before, not everyone is the same. This is super individualized. So what works for you or I might not work for the other person. So it's really figuring out together what is supportive for you. How can you live that fulfilling life? How can maybe, again, not taking messages from the ketamine sessions themselves so literally and asking questions in a certain way so that the person is able to make connections. And there's no, therapy around it. It's just more of a life coaching type of activity and figuring out support that they can harness themselves. And again, it's that whole lifestyle shift. It's changing your life. That's what this is about.
Yes, and I've got a two-part question for you. The first one, I'm curious about how you administer the ketamine. I know that there's three different ways generally people receive ketamine, either orally, intramuscularly, or intravenously. And I'm curious the way you do it as well. If you could just comment on, are they all equally as good? Are some not effective? So any thoughts on that?
So what I'll say first is ketamine is ketamine is ketamine. Doesn't matter which way you get it. If you get enough of it to get to the receptors, it's going to do the same thing. Now, the ways that are available are many. So in addition to the ones you were mentioning, there's intranasal. We also give it intravaginally and intrarectally as suppositories. And to be technical, it's not actually oral ketamine that most of these folks are getting. It's sublingual, which is a difference in that with the sublingual, you're swishing it around your mouth for anywhere from 10 to 20 minutes before spitting or swallowing it. If you take it orally, you're actually swallowing it. So some practitioners do give it also orally in a capsule, and that could be more for pain and or, mood, I guess. But the issue with the variable or the various routes of administration is the bioavailability. And what bioavailability means, the amount of ketamine that is actually getting to the receptors in the brain. So I use mostly intravenous ketamine because the bioavailability is just about 100%. So I know the amount of ketamine in milligrams that I am giving to a person through the IV will get to the brain. As an example, if I'm giving 100 milligrams of ketamine in an infusion over 40 to 50 minutes, I know they're getting just about 100 milligrams to the receptors where they need to be. With these other routes of administration, save for maybe the intramuscular injection, which bioavailability is around 93% in the literature, most of the other ones vary anywhere from 15 to 40%. So if you give 100 milligram sublingual lozenge or troche, you're really only going to get about 15 to 40 milligrams to the receptors, because that's that 15 to 40% bioavailable. So you can imagine if you're trying to get 100 milligrams to the receptors like you would with the intravenous route of administration, you need to increase the amount of milligrams. So there's some, lozenges at home, people are taking 200, 300, 400, 500, I've heard of 600, 700 milligrams of sublingual ketamine. And it's not because they're actually getting 600 of milligrams of ketamine to the receptors. They're only getting a portion of that. And depending on whether you spit the medicine out after you swish or you swallow, which would increase the amount because you will get a secondary absorption through the gut, and that will determine the depth and the length of the journeys. Not necessarily one route of administration isn't necessarily better than the others, but when you have a higher bioavailability, you're decreasing the amount of the ketamine drug, which also has to be metabolized by the body. So you're decreasing some of the byproducts, which can cause some of the side effects. And so that's why, I mean, intravenous is good for bioavailability. It's also good because I can titrate in real time to what the patient needs, wants, whatever's happening. It's easy to adjust up or down in the moment if we want to go deeper, if they're not feeling anything, or if they're feeling too much, but don't necessarily want to stop the journey. And so with these others, once you get the medicine, you've got the medicine. There's no taking it back. And so it's not that it's necessarily unsafe to have it, but sometimes it can be intense or overwhelming. And if the person isn't adequately prepared for such journeys, it might be very difficult and sometimes can be traumatic in its own right.
Yeah, well, it really sounds like intravenous is the gold standard. Just like you said, you can really target how much you're using, less side effects, and it's over when you say it's over.
Yeah, I mean, the truth is, one would think I would be biased to IV, which I am, but I don't think the other modes of administration, when used appropriately and with adequate preparation, are ineffective or bad ways, truthfully. That's the thing. These medicines, again, are super safe. And so if the practitioner really knows what they're doing and they're spending a lot of time prep and integrating and sitting with people while they're on even a difficult journey, it's not necessarily the wrong way or a bad way or an ineffective way of getting ketamine.
For people that might be curious about what ketamine therapy is like, I know you've mentioned the preparation and integration are very important parts of your therapy. What is that like? If I'm your patient and I come to your clinic, kind of talk me through a typical session for somebody.
So preparation in my clinic happens on a different day than the administration of the ketamine. So you can't just call up and say, hey, I want ketamine today. That doesn't work. Some places you can do that, but not at my clinic. And so it's important to really, first of all, be ready when you call to make the appointment and know that this is going to be a slow process. More is not better. Speed is not better. So this is, again, cultivating trust, cultivating safety, cultivating agency. And part of that process is slow. And so the whole process starts at least a week, if not more, prior to their first session. And then after we do that thorough preparation prior to coming in, then on the day of that they would walk in, we have people come for 15 minutes before. We encourage them and invite them to do some journaling prompts that we offer based on what they're coming in with. We do some grounding with breath. And then we move into, if this is their very first one, we would just talk about intentions and goals for the session or where their mind is and learning about what's coming up for them today. They get a little IV. We will be monitoring them continuously with blood pressure, heart rate, oxygenation. I sit with everyone myself at this point, so they're never alone. We also do
Where did they get the IV? As a needle phobic person, I'm just like trying to imagine it in my mind. Is it where? Tell me a little bit more about the IV.
It depends. It depends on how proficient, I guess you could say, the IV placer is, but I can put an IV anywhere there's a vein. Anywhere you want the IV, you can have it. And I numb the skin with a little bit of lidocaine before. So it's it's less uncomfortable than folks might think. And it's a pediatric sized IV. And it can be anywhere.
Thank you. Okay, so you've given the IV and you're personally with the client during their experience. How long are they there for?
It's usually in the range of, or how long are they journeying for, or how long are they? Yeah, so the ketamine infusion itself is somewhere in the range of 40 to 55 minutes, depending on what's happening. And I kind of judge after the first session to know how sensitive they are and how fast they metabolize, which kind of steers then how long the infusion is. The appointments in my office are 2 hours and 15 minutes. And so depending on how fast they metabolize the medicine after it's turned off, if they're a slow metabolizer, we kind of stick towards that 40 minutes. If they're pretty fast at having the ketamine wear off, then we go towards 50 or 55 minutes just so they get a little more medicine there. And as they're journeying, again, this is a very client-directed process. And so if someone wants to talk, I'm there to talk. If they don't want to talk, I'm there to take notes, kind of as a scribe, more of like a guidepost. We like to say kind of they're in a hammock and they have the support of music, me, and the medicine kind of holding them up as they kind of swing freely, never to fall, as they kind of take this boomerang journey going out and always coming back, no matter how far they get. And to that end, I give them music in headphones and or in the room. So I'm listening to the same music that they listen to in their ears. Now, all of these things that we offer, the headphones, the eye mask, the music, they're all an invitation. And so if there's anything for folks that feels uncomfortable or scary or whatever, I am never taking things personally. This is not my journey. And again, I don't know what's best for each person. One time I had a person who in the middle of the session was like, I don't like this music. I want to listen to Ozzy Osbourne. So we listened to Ozzy Osbourne for an hour, and the guy just fully drummed the entire thing. And I actually haven't seen him. He's been great since then. So, to each their own. Everyone knows what they need for themselves. I am just a safe keeper. I'm not the doctor who knows what's best for you. I'm just a doctor who keeps you safe medically, both physically and psychologically, while you give yourself permission to explore within. And that's it. So there is no typical journey. I have invitations for everyone kind of based on where they are in their progression of the ketamine journeys. And so, yes, I have different musical creations through a company called Wave Paths that allows also client directed music involvement. It's interesting because their live recorded waves, quote unquote, are created in a studio by professional musicians, DJs, composers, vocalists, and then you're able in real time to kind of DJ a person's journey based on emotionality, intensity, nature sounds, whatever is kind of coming up or that you want to try to evoke. It's all possible. But, when people aren't interested in that, really anything goes. I tell people on that initial consult, there's 3 rules. You can't hurt you. You can't hurt me. There's never sexual touch. And other than that, anything, sky's the limit. And I'm there for it. So, everyone's a little different. Everyone's journey looks a little different. And this is, everyone has a different journey from one to the next. So again, when you walk in the second time, expecting what you had the first time, it's never that way.
Okay. And then are you doing integration the same day, a couple days later? How does that work?
So a couple things. So as people are coming out of the ketamine infusion, we do more of like a debriefing. So I like to tell people it's less about analyzing and more about experiencing on the day of these journeys. And so that debrief moment is kind of the beginning of integration, right? Because you're doing a download where helping you to get it out of your brain and body and out into the world so that you can revisit it later and do the analyzing. The day of the session, in my opinion, is all about just downloading, experiencing in all 5 senses, talk about the tickly finger or the yellow square or whatever it is, and just download like the messages. these journeys are kind of dreamlike. And so you can imagine when you wake up from a dream, you remember stuff, and then 2 minutes later it's gone. So the same is true here. So the more you can just kind of get out of your mind and into the paper, then you can do all the analysis and connection making later. So that day is more about just experiencing, downloading, debriefing. The integration we usually schedule, it depends on when they see their regular therapist. So we like to consider more touch points on different days. So if they have their therapist on one day, then we do the integration session on the following day. And so there's more time for bouncing ideas off of folks and making more connections and more changes. Yeah, I mean, all this is the neuroplastic effects and the new connections is just habit forming, right? And so what I always give the example of when I learned to floss my teeth in my early 20s, initially I had to sit there and look in the mirror, and it took me 30 minutes to do it all. And now I don't even need a mirror, and I can do it in like 2 seconds. And so it's practice, 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 practice. And that's what all the changes are just new habits, and they need practice. Same thing, you imagine you go to the gym, you work really hard for that month to get your body in shape for that big event, and then after the event you don't go to the gym anymore. Guess what? You go right back to where you were. The same is true for work in between ketamine sessions. It's it's never ending. I hate to say it. Let me say it again. It's never ending. You have to keep working. With all of these therapies, you're going to get out of it what you put into it. There's always going to be learning. And, if you don't use it, you lose it. All these sayings are made because they mean something. And so it's the same work that you have to put in to anything else is with ketamine therapy.
I'm curious about your experience the first time you did it. You said it went horribly.
Yeah.
And now that you're an expert in this field,
I'm an expert.
If you are an expert, if you can identify what made it go horribly, was it something about the way it was administered, or why was that so bad? If you feel comfortable sharing.
Oh yeah, I feel comfortable sharing. I mean, it wasn't, well, first of all, there was zero preparation. There was no heads up on anything except for I knew I wasn't supposed to drive afterwards. That was the one thing. The setting was it was like a closet in a crappy office, and there was painter's tape all over the place, and the provider just gave me weird vibes. There was no eye mask, no music. I looked at my phone the entire time, just because part of it was I didn't trust the person giving me the medicine. The other part was there was no other options that unless I brought something, which I didn't know to bring. And then just the conversation with the provider was unprofessional and weird. And when I left, there was no follow-up. There was no integration. There was no confirmation actually that I got a ride home. He just let me leave. It was interesting. And also while I was already on the medicine, at the end, he was asking me about giving permission to charge the credit card for 6 sessions. And I was like, no, thank you. So it was just a lot of feeling unsafe for any number of reasons. I didn't feel unsafe because of the ketamine, and that's because I knew how safe of a medicine it was. And truthfully, if I knew anything was going crazy, I could just rip the IV out myself. I wasn't worried about that. But the ambiance and the setting of the space was not safe producing and or trust building in any way.
Right. I could see your system working so hard to keep you safe, to protect you, and not able to really let into the medicine. It was, and when I walked out of there and I was thinking, I felt high, but I don't know what that's going to do for people. Truthfully, I was like, I don't know how this helps with depression. And so then I started to do a little more digging into what that might look like, and just using my own experience with psychedelics and knowing what feels good and what feels safe,
and how to support that and support people in altered conscious levels was how I kind of built what I have now as a practice.
Yeah, I can really hear how your experience informed how you are as a provider and to make sure that nobody else has to go through that.
Yes, that's right.
And that leads me to kind of one of my last questions. You've talked a lot about what you do in your clinic and how important safety is to you. And if there's somebody out there that's curious about trying ketamine therapy and they're kind of interviewing different clinics, are there a couple things that you could tell them to look out for that you would recommend to a friend or family that in looking for a treatment?
Sure. I mean, when people are reaching out to practices, preparation and integration, they have to have some at least suggestions on how to go about it. I mean, even if the clinic itself doesn't have a built-in preparation or integration person or referral system, there are ways to get those support services outside of the clinic. And the clinic should at least be aware that that is a possibility and have either therapists or other providers that they refer people to do that work outside of the actual medicine sessions. The other thing I would say is very important is the setting that the journeys happen. And they don't have to be uber, non-clinical, but they should feel at least warm and inviting, maybe not so sterile. I think it is important to have someone sitting with you that isn't a friend or family member, honestly. And part of the reason I think that is there's a lot of expectations from friends and family that go along with them supporting you. And oftentimes you're not able to really let go because you're worried about, oh, I might say something that's going to scare my X, Y, or Z person, and or I don't want them to know it, or it would be embarrassed, and that holds you back a little bit more. And so having a person that is accompanying you on this journey and the times when it's overwhelming or intense that isn't a friend or a family, I think is important. Another thing that may not be popular out there is I think the people that are providing the medicine should have tried it themselves. Because in my opinion, I don't think that you can support someone adequately without having undergone one of these journeys yourself. And you should understand deeply where the possibilities for people to go are and understand how to help them if they find themselves in a place that feels overwhelming.
Yeah, just to summarize for anybody listening that's curious about this, having a clinic that has some thought to integration and preparation, even if they don't do it themselves, they recognize how important it is. Getting a feel for the room that you're going to be in, like maybe no painter's tape or a closet. It would be great if they would let you tour where you're going to be receiving the medicine. You can get a feel for that in your own body. Do I feel comfortable here? Also with the staff. Do the staff make me feel welcomed and safe? Will somebody be sitting with me the whole time? What are their qualifications? Who is this person? And then also the person working with me, have they done their own work? Do they understand this medicine? Can they help me out of a hole if I find myself there?
And one other important thing is, will this practice interact with your regular providers? A big piece of building the trust is the therapeutic alliance. And I include that alliance, or I believe that an alliance to include the psychiatrist, the therapist, the client, the ketamine person, and anyone else that is involved in supporting the client. I mean, we even have family education that we do, because in order for someone to feel held, they need to feel like all of their support crew are involved. So a ketamine practice should really be open to communicating with other providers that support you.
Oh, that's a great point.
Yeah.
I'm curious if there's anything about ketamine therapy that I didn't ask you that you think is really important for people to know.
I think that there are many, many safe and effective ways of receiving ketamine. And one way is not necessarily better than the other ones. What matters is how the provider of the ketamine is offering the medicine to you, in what context, and how they include the ketamine in the overall program for healing, not just you're getting the ketamine to fix your X, Y, or Z. It really is just a tool. That is it. It can't be seen as it's a cure. You're not going to, this is just a piece of the puzzle. And it's really important to emphasize that. It's really important to emphasize that it's a slow process. This is a slow process. And more ketamine is not always better. Some people are like, I need twice a week. I need, and they have a lot of demands and expectations based on what is out there on the internet. And I find that the ketamine itself is the smallest piece of this healing puzzle. It is the therapeutic container. It is the therapeutic alliance. It is the dedication to change that the person has. And the medicine just is a little tool that kind of loosens up all the craggles to allow the person to do these things a little easier. It's not a magic pill.
Not a magic pill. Yeah, you have to be willing to do the work and you can get a great benefit. I think there's one thing I forgot to ask. It's kind of a non sequitur, but how many sessions in the average treatment?
Like we always emphasize, everyone's a little different. Everyone is struggling with a different thing. Their biochemistry is different. And so the long story long is it's different for everyone. I would say the average for the garden variety treatment-resistant depression is anywhere from 4 to 8. If we're dealing with more of an anxiety or trauma or, something that requires a slower process to feel safe, those people usually end up needing more on the end of 8 to 10 sessions. And again, none of this is set in stone, at least in my practice. I don't sell packages. This is a conversation always between client and ketamine provider and their other mental health professionals to determine, is the medicine still useful? Are they learning something? Is there still room for growth? And the answer is that it is very individual.
Yeah. Yeah, I love how much thought you put into safety and going slow and really helping this land for people. It's not just like a farm where you're pumping them through and
No.
It's so personalized. I really admire that, and I really can feel the safety in my own body as I'm listening to you talk about that. Yeah, I really love the emphasis on safety. And I'm just curious. We ask people the same question in every podcast, and it's, what are 3 elements in your own personal life that really contribute to your well-being?
Well, number 1 is probably community. So for me, community includes my family, my friends, my dog, really making connection in the world. I still have a very strong breathwork practice. We actually offer hosted breathwork every other week for my clients. And so I do that. I do daily breathwork with an app called The Othership. And gratitude practice daily, for sure. That's a huge one.
Connection, breath work, and gratitude. It sounds like a recipe for healing for me.
Yeah. Oh, thanks.
Well, Dr. Sara, thank you so much for taking the time to talk to our listeners today and educate about ketamine therapy. Where can people find you if they want to come see you as a patient, or if they just want to follow you on social media?
Yeah. So my website is www.softrebootwellness.com. If you find the same on Instagram. So at Soft Reboot Wellness. And then if someone wants to shoot me an email, you can email DRSARA, like Dr. Sara, at softrebootwellness.com. It's probably the best way.
Dr. Sara, thank you so much for taking the time today. Thank you for all the amazing work you're doing to help people. And it's just been such an honor.
Great to talk to you, Michelle.
Thanks so much for listening. This has been Sophia Unfiltered, a podcast by Sophia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Reese. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.